Are you making one of these 7 blood pressure mistakes without even realizing it? The truth is, many older adults do everything they can to stay healthy, but still struggle with high blood pressure. That's because small, everyday choices, things that seem harmless, can quietly work against your heart. And uncontrolled blood pressure isn't just a number on a screen. It puts you at serious risk for stroke, heart attack, kidney damage, and even memory loss. In this video, I'll walk you through the 7 critical blood pressure mistakes I see most often in people over 60. These are the habits, oversights, and misunderstandings that quietly increase your risk without symptoms. We'll talk about why missing a single medication dose matters more than you think, how salt hides in your favorite foods, the silent dangers of not checking your pressure at home, what stress and sleep have to do with your heart, and more. If you want to protect your brain, your heart, and your independence, this is one video you cannot skip. Let's get right into it. Mistake number 1. Skipping blood pressure medications or taking them incorrectly. Let's start with the most dangerous mistake: skipping your blood pressure medicine or changing how you take it. I've had many older patients say, "I felt fine, so I didn't take it today," or "I didn't want to rely on pills, so I cut the dose in half." But here's what you need to understand. Blood pressure medications don't just treat symptoms. They manage a long-term risk. You might not feel high blood pressure. That's why we call it the silent killer. But the damage builds quietly over time. When you skip doses or change your dosage without a doctor's guidance, it can cause sudden spikes, rebound hypertension, or make your treatment less effective. You also run the risk of drug interactions if you take medications at the wrong time or with certain foods. So what should you do? Take your medication at the same time every day. Use a pill box if you forget. Never stop or change a dose without talking to your doctor. It seems small, but it can literally be the difference between a healthy day and a trip to the ER. Mistake number 2. Ignoring salt hidden in everyday foods. You may not add much salt to your food, but the salt that harms your blood pressure often comes from what's already in the food. Canned soups, store-bought bread, frozen meals, salad dressings, even so-called healthy items like turkey slices or low-fat cheese. These foods are often loaded with sodium. For older adults, high sodium intake stiffens blood vessels and increases fluid retention. That pushes your blood pressure higher without you noticing. Here's a good rule. If it has a label, check it. Sodium hides in places you wouldn't expect. Even a slice of whole wheat bread can have over 200 milligrams. Here are better options. Cook fresh foods when possible. Use herbs like basil, rosemary, or garlic instead of salt. Look for labels that say low sodium or no salt added. You don't need to cut salt completely, but you do need to control how much your body absorbs, especially if your kidneys aren't as strong as they used to be. Mistake number 3. Not monitoring blood pressure at home. Too many people rely only on their doctor's office to check blood pressure, but pressure levels can change throughout the day, and we need to see the full picture. Home blood pressure monitors are simple to use, and they give you the power to track what's working and what's not. I once treated a man in his 70s who had normal readings in the office but dangerously high pressure in the morning. We only caught it because he started checking at home. Here's what I recommend. Buy an upper arm cuff with a digital reader. Check your pressure at the same time every day. Rest quietly for 5 minutes before taking it. Keep a log and bring it to your appointments. Monitoring at home gives you more control, and it helps your doctor adjust treatment before problems get serious. Mistake number 4. Leading a sedentary lifestyle. The older we get, the easier it is to sit more and move less. But lack of movement causes more harm than we often realize. Physical activity keeps your blood vessels flexible. It helps lower resting pressure. It improves circulation, balance, and even mood. You don't have to run marathons, but even a 20-minute walk a day can lower systolic pressure, improve heart rhythm, help manage weight. Stretching, light resistance training, and chair exercises are also effective. The key is consistency. I had a patient in her 80s who started walking after breakfast each morning. Within 3 months, she needed less medication. Move your body, even gently. It matters. Mistake number 5. Not managing stress or poor sleep. Stress isn't just emotional, it's physical. When you're under stress, your body releases hormones like cortisol and adrenaline. These raise your blood pressure. Over time, chronic stress damages your arteries. And sleep. Poor sleep, especially in older adults, increases morning blood pressure. It also interferes with recovery, memory, and hormone balance. Many older adults have disrupted sleep due to nighttime urination, pain, worry, or loneliness. Here are some gentle ways to help. Create a calming bedtime routine. Avoid screens before bed. Try gentle breathing exercises. Keep the room cool and dark. Stress reduction isn't about removing all stress, it's about managing how your body responds. Mistake number 6. Overuse of pain, relievers, or cold medications. Many over-the-counter medications can raise blood pressure without warning. This includes ibuprofen, naproxen, cold medicines with decongestants, like pseudoephedrine. These drugs affect blood vessels, kidneys, and hormone systems. Older adults often take these without realizing the risk, especially for arthritis, headaches, or sinus issues. Always read the label, look for warnings about high blood pressure, and ask your doctor or pharmacist before starting anything new. There are often safer alternatives available that won't put your pressure at risk. Mistake number 7. Drinking too much alcohol or caffeine. A glass of wine here and there may be fine, but regular alcohol intake can raise blood pressure, damage your liver, and interfere with medication. The same goes for caffeine. As we age, our bodies become more sensitive to its effects. For some seniors, even one strong cup of coffee can raise pressure significantly. Here are safe guidelines. No more than 1 alcoholic drink per day. Limit caffeine to 1 to 2 cups of coffee or tea daily. Stay hydrated with water, herbal teas, and low-sodium broth. Pay attention to how your body reacts. If you feel flushed, jittery, or lightheaded, it may be time to cut back. Let's review the 7 critical blood pressure mistakes to avoid. Skipping or changing your medications. Ignoring hidden salt in everyday foods. Not checking your pressure at home. Sitting too much and not moving enough. Letting stress or poor sleep go unchecked. Overusing painkillers and cold medicines. Drinking too much alcohol or caffeine. If you recognized even one of these in your daily routine, the good news is you can change it. Blood pressure doesn't have to control your life. With small, smart steps, you can protect your heart, your brain, and your independence. This isn't about fear, it's about freedom. When your blood pressure is stable, you feel clearer, stronger, and more capable. So take one step today, then another tomorrow. That's how health is built. If you found this video helpful, please like it. It helps others find important information like this. And if you want more honest, practical health tips for people over 60, subscribe to Glowing Age. We're here to help you live longer, stronger, and brighter. I'll see you in the next video.